In this video, we'll be covering the process of recording the patients ready to go back from recovery to the ward. So recovery would have the capacity management application open. We have down on the bottom section the bed board for recovery, so we can see which bays are available, which bays are occupied, and at the top section we can see our transfer list where requests have gone in for patients to go to a different location. So in this instance, our patient here in Bay 2, in this instance it's called Bed 2 for recovery, is ready to go back to either the location they came from or to a different post-operative location. So we would need to go onto the patient's record in PowerChart. So onto PowerChart, we can either use the perioperative tracking board to see the patient and then double click on the arrow to the left of the name to open the patient's record. Once we're in the patient's record, we would navigate to request care plans and we would select the add button. We can type in location and select transfer patient location. We would click done and the form would appear in the background, and we just need to complete 2 mandatory fields and 1 optional field. So the main speciality would be whatever speciality the patient's under. Go trauma and orthopedics in this instance, and the transfer reason would be recovery to ward, but on cert this is options not built, so we'll say theatre to ward, and I think there is also an option for other if not, but in this instance we'll just go theatre to ward. And this target unit field is optional. If you do know where the patient's going post-operatively, then you can select the option from this list. But obviously, if you're not sure where the patient's going to post-operatively, you can just leave it blank. So once we've filled out those 2 mandatory fields, we would select sign. That signs the form, and if we return to the capacity management, we can now see that our patient has appeared on the transfer list, in this instance with no destination. So that would be ready then for the appropriate post-op location to pick up and drag into the area and the bed that the patient would be going into post-operatively.